This is the revision PowerPoint for Unit B1, Drugs. Are the following statements about drugs true or false? All drugs are harmful, true or false? False. Some drugs are available over the counter from chemists or are prescribed medications that make us feel better and can treat diseases. All drugs are illegal, true or false? False again. Some drugs like caffeine are found in everyday products like coffee. Others like alcohol and nicotine in tobacco are legal if you are over a certain age. Drugs are chemical substances which change the way your body functions. True or false? This one is true. A drug is any chemical that alters the way your brain or body works. Drugs may work by altering your behaviour or altering your metabolism. Drugs change the way a person behaves and feels. True or false? This is also true. Whilst not all drugs will necessarily have a noticeable impact, they will alter your brain or body in some way. Hallucinogens are drugs which change what a person sees and hears. True or false? This is true. Hallucinogens are drugs which cause a person to hallucinate, which includes seeing and hearing things that aren't real. Depressants slow down the workings of the brain. True or false? This is true. Depressants slow down nerve activity by reducing the activity of synapses. They do this by binding to receptor molecules in the synapses, so neurotransmitters cannot bind to them. Alcohol is a depressant. True or false? This is true. Alcohol slows down brain activity, causing characteristic symptoms such as lack of coordination and slurred speech. Illegal drugs are classified based on how dangerous they are. True or false? This is again true. In the UK, illegal drugs are in one of three categories, A to C, depending on the severity of their effects. Caffeine is a drug. True or false? This is true. Caffeine is a stimulant found in coffee, Coca-Cola and energy drinks. Paracetamol is an antibiotic. True or false? This is false. Antibiotics are drugs which kill bacterial cells and are used to treat bacterial infections. Paracetamol is a painkiller. This does not cure diseases but can be used to alleviate symptoms. Painkillers work by blocking nerve impulses responsible for the sensation of pain. Heroin is a painkiller. True or false? This is actually true. Heroin is a form of opium which has been used by mankind as a painkiller for centuries. It is very closely related to morphine, a very strong painkiller used in hospitals. Aspirin is made from the bark of willow trees. True or false? This is true. The active ingredient in aspirin, known as salicylic acid, was discovered in willow tree bark in the 1700s. Coca-Cola used to contain the drug cocaine. True or false? This is in fact true. When Coca-Cola was first launched, its two key ingredients were cocaine and caffeine. Nicotine is the drug found in tobacco. True or false? This is true. Nicotine is an addictive stimulant found in tobacco smoke. Alcohol and tobacco cause more death than any other drug. True or false? Again, this is true. As tobacco and alcohol are legal drugs, they are more readily available and are therefore used by far more people. Drugs can be grouped into different categories depending on their effects. The 5 types of drugs that you need to know about are depressants, stimulants, painkillers, performance enhancers, and hallucinogens. Depressants reduce the activity of the brain by slowing down nerve activity. Examples of depressants include alcohol and solvents. Painkillers relieve pain by blocking nerve impulses, and examples of these include aspirin and paracetamol. Stimulants increase alertness, attention, and energy by increasing the activity of the brain. Some examples of stimulants include nicotine, caffeine, and ecstasy. Performance enhancers are substances taken by athletes to improve their performance. They do this by increasing muscle development. An example of a performance enhancer is anabolic steroids. Hallucinogens cause changes in perception, often making the user see and hear things that aren't real. Examples of drugs which are hallucinogens include cannabis and LSD. As well as knowing the effects of these drugs, you also need to know how depressants and stimulants cause their effects on the nervous system. Depressants slow down the functions of the brain because they bind with receptor molecules in synapses. This means that when an impulse reaches a synapse, its progress is slowed because the neurotransmitter cannot bind with the receptors that are blocked. Stimulants, on the other hand, increase the activity of the brain. They do this because they cause more neurotransmitter to be released into the synapses. When you smoke a cigarette, the smoke passes into your lungs. Substances in the smoke then get into your blood and are carried around the body. Tobacco smoke contains over 4,000 different chemicals. Some of them are shown in this diagram. They include chemicals such as tar, carbon monoxide and nicotine. Tar is an irritant and is carcinogenic. A carcinogen is a chemical which causes cancer. Tar can cause cancer of the lungs, throat, esophagus, mouth and bladder. Tar also damages ciliated epithelial cells in the trachea, bronchi and bronchioles. It prevents the cilia from working properly, meaning that mucus accumulates, causing a smoker's cough and can lead to bronchitis. Carbon monoxide is another chemical found in tobacco smoke. Carbon monoxide reduces the oxygen carrying capacity of the red blood cells, so that less oxygen is taken to your cells and tissues. This means that the heart has to work harder, and this can contribute to heart disease. If a pregnant woman smokes, then less oxygen gets to the developing fetus, and this can lead to low birth weight of the baby. Nicotine is the addictive drug in tobacco. It is the reason smokers find it difficult to stop smoking. Nicotine also increases heart rate and therefore puts strain on the heart. Alcohol has been drunk by humans since prehistoric times. It can make people feel relaxed as it slows down the activity of the nervous system. The effects of alcohol can be split into short-term and long-term effects. The short-term effects of alcohol include blurred vision, impaired speech, impaired judgment and mental confusion, increased reaction times, impaired balance and loss of muscle control, loss of self-control, violent behaviour, drowsiness, increased blood flow to the skin, which means you feel warm but are losing body heat, and if too much alcohol is consumed, it can also lead to unconsciousness or coma. If someone consumes large amounts of alcohol frequently, this can lead to serious problems over longer periods of time. These long-term effects include cirrhosis of the liver, brain damage including loss of memory and depression, weight gain, fatty liver, increased risk of diabetes and heart disease, cancer of the liver, mouth, throat and esophagus, and drinking can damage a fetus if a pregnant woman drinks.